sometimes people ask us, what is it that you do best, better than anybody in the world? And what we do best is to diagnose the difficult problems. We take this fetus who has some thing that other people can't figure out. They can't figure out either the anatomy or the physiology or a treatment strategy or a syndrome, and they come to us and they say, we don't know what this is. This is a problem. We think this is, I don't know, for example, I had a baby recently referred to us. We think this baby has an imperfect anus. So it means it has no anus. So we said, okay, well, we looked at the pictures and looked at their pictures, actually. We didn't even look at our own. We said, no, that's not the problem. The problem is in the urinary tract. The urinary tract is connected to the anus, and not only that, but the child has, based on their own pictures, the child has a problem with scrotal and penile development, and the urine is backing up into the rectum because of a connection, and this baby probably has this syndrome, and this is what we need to do. In that particular case, it made all the difference in the world to the parents, because if that baby was born, and with the diagnosis saying, okay, your baby doesn't have an anus, but it's otherwise a normal boy, they would have been rocked to their foundation when they heard, when the baby was born, oh, actually it's a girl with funny genitalia and it's peeing into its rectum. I mean, but when that particular child was born, the parents said, oh, we already know about this. We already know what we're going to do. We've already decided our treatment strategy, and we already have all the people on board to treat it. I mean, it was already sort of they'd already processed, they had months to process all this information, and they'd come to grips with it. And that's what we do best, is these diagnoses of what are initially, very confusing problems or issues that just can't be understood. And we can bring all our experts together, like at our conference, and talk about it and say, you know what, it fits together in this package, not as all these little individual problems. And then we come up with a solution for it. In that particular case, it was, complex reconstructive surgery, which is ongoing. But that's what we do. We solve the really difficult problems that others think are unsolvable or lethal. And it's routine. We do it all the time.